want you to punch, go out and crunchy through your shoulder, all the way through as far as you can, and then down all the way across your body. Okay. Obviously, she's super flexible. I can like take her back to the next state and bring her all the way through Florida and then down to the Bahamas with this one. Hey guys, what's cracking? It's Dr. Eric Smith back with Laura, and today we're going to work on this muscle that from her workouts, she's gotten really sore, right? So this is a lot from kind of doing lat pull downs, getting really wide on it. Yep, so when she's there, and actually do that for me. So you're going to work this muscle, and this is what's sore. So it connects and goes over here, and you can get a lot of tricep stuff going on. So you can just see she's working on these, get some muscle going on there. Flex. Good. There we go. And so that's the sore guy that we're looking at here. And so I'm going to show you a little bit of thing that I do for that. Normally what I did, which I already did, was use portable cold laser. If you don't have cold laser at the practice, cold laser is great for healing. I'm not going to show the 5 to 8 minutes I use it for, but basically what it is, it's intense heat that goes underneath the skin, but it doesn't hurt. So, because it didn't hurt when you did it, right?
No, it felt great.
Awesome. So what I am going to do though is I'm going to do we're going to pin the muscle down and we're going to stretch it. So what that does is gets the muscle to release at the local level and overrides kind of what's going on in the brain. So that way it's going to release, and then typically I'm going to want her to use a lacrosse ball or something to roll through that just to loosen it up, and then just stretching. So if it's torn, say it was really bad, if you have a red mark back there or some turn colors, that means you probably tore it at the musculotendinous junction. I would not do this. So I do suggest that you see a doctor or somebody who knows what's going on to make sure that this is the treatment to do. So just make sure I don't get a whole bunch of cream on your clothes here. Just gonna tuck this around.
We appreciate it.
Yeah, I don't want to mess up the clips. So a little bit through here, and then what you're going to do is the motion for this muscle was what we saw with the lat pull down. But what we're going to do is a little like boxing type move. Okay? So you're close. You got it. So what you're going to end up doing is you're going to take your arm like this, and I want you to punch, go out and crunchy through your shoulder, all the way through as far as you can, and then down all the way across your body. Obviously, she's super flexible. I can like take her back to the next state and bring her all the way through Florida and then down to the Bahamas with this one. So, but I'm going to make sure I hold her shoulder in the right position, because like most people, they tend to internally rotate, and that's going to create a problem. So potentially when she was doing the lat pull down, if she was internally rotated and did that, that's what created it. Because if you see the vector of her shoulder, it went there. And so if I put her shoulder in the right position and she did a lat pull down, it wouldn't be as problematic. So we'll work on that though. So what you're going to do, remember, we're going to do that 5 times. So this is some muscle tissue release. Go ahead, all the way through and down. Go ahead, just pin. Good. One more time. Down. Good. Come on, 2 more actually. Let's do it. You got this. Good. One more right down there. Good. So, what we can do too, for a couple more, is I want her to do that right position. So, yeah. So I want you to be back here with it though. So we're going to start here, and I want you to slowly go up for me, okay? Wait till I tell you. Ready? 3 times for that. Go ahead. Oh, deep breath on that one. 2 more. You got this. Good. 1 more. Awesome. So that is a soft tissue type thing that I like to do with my patients. You can put your arm in there. We're done with that part. So I'm just going to wipe this off, do a little bit of stretching with her. But if you have that type of thing, that is an easy thing that your chiropractor, somebody who's well trained, can work on to get that to release, get you back in the gym. So if you have any questions, comment below, and we'll see you next video.